What just got announced for Medicare coming up will impact you. If you're brand new to Medicare, or you're already on a Medicare supplement, Plan G or N, or a Medicare Advantage plan, you better watch tonight's video in its entirety. I've got some amazing, shocking things that'll probably blow you away that will impact you in 2025 and beyond. First, here's what just happened in U.S. Senate just 2 days ago. Watch this.
And Mr. Chairman, you understated the problem. It's hard to imagine that as senators, but we've understated the particular problem. Let me just tell a quick story. Running our hospital, had a horrible ice storm on a Wednesday night. Thursday morning, the hospital is booked for surgeries. Orthopedic surgery already starting at 7:30, and they're going to go till 10 o'clock at night. The other ORs are full. We have a finite number of surgeons, anesthesia, and nursing staff. We had 7 or 8 admissions overnight. People falling, breaking their wrist, breaking their hip. So I give authority to, we're going to bring everybody in at 5:30 in the morning, start the cases at 5:30. 90-year-old lady fell and broke her hip, which is a critical, life-threatening thing to a 90-year-old lady. And you get everybody there, and then the administrator comes and says, oh, we can't do this case. How come? Well, we don't have prior authorization yet. That story is told over and over that insurance companies are now using this to ration care. It's delaying care and purposefully delaying care, hoping, I guess, that they die before they do the surgery.
It's not just Medicare Advantage, though. There are changes that will impact you no matter which type of Medicare you take. Hi, my name is 𝗪𝗏 𝗏. I've been a licensed insurance agent for 27 years now, helping people with insurance and focusing particularly on Medicare. Today, we're going to talk about a few things that will impact you. First, the Senate hearings that just happened in the Budget Committee. Then Medicare claims and the losses that they experienced last year. And they're just now starting to feel the impact on this year and beyond. I'm going to go into that in just a second, how it will impact you. Again, no matter which kind of Medicare services you get, then the 2025 outlook for Medicare will be shocking to you. I'm going to make a prediction, and I've been right every other time. Let's see if I'm right this time. And then where you can get free help. Who's watching the market every single day, watching these long, boring congressional hearings on what's happening with Medicare and how they will impact you? First, let's talk about some of the new articles that have come out since I last briefed you. This one is an article from the American Journal of Managed Care talking about complaints to Congress, and this is talking about Medicare Advantage. In the survey, the Medical Group Management Association reported that 89% of respondents, those are doctors, found that prior authorization requirements are very or extremely burdensome. And so this is just, again, going into Medicare Advantage, as we just heard the senator, who's also a doctor, talk about Medicare Advantage and how it's different than original Medicare, and it prevents you from getting services when you need it the most. Here's another one from the Kaiser Family Foundation, an article that's recent since the last time I was with you. And it starts, quote, for example, Medicare Advantage insurers are not required to report prior authorization requests, their denials, or appeals by type of service. We're trying to get that changed. Here's another one from a Penn State University, a Penn State study talking about the billing bottleneck, how Medicare Advantage insurers use prior authorization. And it says, we found widespread use of prior authorization for medical services in Medicare Advantage, not original Medicare, which is in marked contrast to traditional Medicare. That's Medicare with a supplement. These findings add to previous literature suggesting that Medicare Advantage reduces healthcare use relative to traditional Medicare. And that's fine unless you want to have your healthcare reduced. And how do you do that? By signing up for a free Medicare Advantage plan. And it goes on, and it continues to say the results are consistent with previous studies showing that high prevalence of medical services suspected of being low value in fee-for-service. Furthermore, this finding suggests that insurers' financial savings from prior authorization programs exceed their costs at administering them. So what they're trying to do is save money at every turn. And there's a report, of course, from the Office of Inspector General talking about prior authorization, again, only with Medicare Advantage. And if you don't understand what's the difference between Medicare Advantage and original Medicare, these are the two choices that you have that most insurance agents today won't tell you about both choices. They'll only tell you that you must sign up for a Medicare Advantage plan. You should see this study. It's linked in the description of this video before. It's from the Office of Inspector General. They monitor what's going on with healthcare. And the study itself literally says some Medicare Advantage organization denials of prior authorization requests raise concerns, you better believe it, about beneficiary access to medically necessary care. This is rampant in the industry. Here's another one. Another new story from the National Law Review says 2 new proposed rules for Medicare Advantage plans expands beneficiary rights. And that's true. They are proposing these new rules, which will finally, possibly, rein in Medicare Advantage. This study from Axios says hospital and insurers battle over Medicare Advantage set to grow. Tensions between hospitals and Medicare Advantage insurers are poised to keep growing. They're fighting with each other. Hospitals are turning away Medicare Advantage plans now. As the program gets larger and the federal government takes a harder line on health plans, and here's why it matters. How hospitals and insurers respond to financial threats could ultimately affect the care received by more than half of seniors who are now enrolled in the program. The program is Medicare Advantage, and they simply don't know what's in store for them. Our goal here is to educate you on that. This continues to say, hospitals have been sounding the alarm about an uptick in Medicare Advantage plans denying claims, paying less than what providers bill for, and taking too dang long to review requests to authorize care, which they say is wreaking havoc on revenue streams. This comes on the heels of inflation and medical labor shortages, which increase costs for hospitals around the country. Health systems get paid an awful lot less in government programs, talking about Medicare Advantage versus commercial. So given the historic inflation that a lot of providers have had to incur, it's become unacceptable for a lot. And for a lot, he's talking about hospitals. It goes on, insurers are trying to spend as few funds on the patient as they can. This is a game they have decided to play, which minimizes their payment to hospitals and other providers, says Chip Kahn, president of the Federation of American Hospitals. The big picture, the conflict has long been simmering. A recent survey of health systems chief financial officers said that 19% of health systems stopped accepting one or more Medicare Advantage plans. So as you're considering, if you're new to Medicare, if you're turning 65 or the like, and you're wondering, where do I go for my plan? Should I get a free Medicare Advantage plan? It sounds good, just copays and my protection of max out of pocket. Or do I stick with original Medicare, which seems expensive, and get one of those Medicare supplement plans? Today, I'm going to provide some context for you and show you what the true reality is when you choose one over the other. And that's what I'm showing to do today. And I've already shown you 6 articles. More than 60% of the hospitals now have said that they have plans that they're considering dropping this year. Medicare Advantage payment problems may be particularly painful to rural hospitals. If you don't live in a big city, your choices next year, 2025 and beyond, are going to be limited. Mark my words, and I'll show you the proof here in a second. It's pretty bad. Let's talk about Medicare claims and losses. Since COVID, now what happened during COVID was interesting. People just didn't go to the hospital. Why not? They didn't have preventive tests that should have been done. They just stayed at home. Why did they do that? Because they were told not to go anywhere. They were told to hunker down, stay at home, everything will be fine, just take your shots, you know. What ended up happening was the Medicare supplement companies and the Medicare Advantage companies' profits were off the chain. They made more money than anybody. All the banks were losing money. All the businesses were losing money. The government had to fund and subsidize small business everywhere, but insurance companies were making money by the boatload because they continued to take the premiums in, but yet they weren't paying any claims. Well, what happened since then? I'm glad you asked. Things had a rebound effect. As a matter of fact, here's the exact ratio of what happened. Look at the claims in 2020. They dropped precipitously. I love that word. But then watch what happened after that. They came back. People started getting the tests that they had neglected before. Then based on the results of the test, they started getting the treatment that they had neglected before. And what suddenly happened was, with these losses, all of the rates started going through the roof for what they had to justify. Matter of fact, last year, there were only 2 Medicare supplement companies. I won't call them out today, but we sell for all of them. Only 2 of them made any kind of profit in 2023. How can that be? The rates are so high. No, they lost money in 2023. So now all the Medicare supplement companies are running back to the insurance departments in the states and saying, we lost money, we have to raise rates. Well, here's how they lost money. If you want to go in detail, which plan, if you're on a Medicare supplement plan, and I'm a big advocate of Plan N instead of Plan G, which pays us more commission as an agent, Plan N is my preferred plan, and let me show you yet another example of why. Here are the losses in 2023 based specifically on which Medicare supplement plan you are on. I want to show you this. This is Plan G. This is the one that all the insurance agents try. I say all, not the ones that I've trained and I've worked with. Most all of them want you to get into Plan G because it's simple. It's simple to explain, and it costs more in premium. And guess what? We as insurance agents, let me share a little secret with you. We make a commission based on the number of the dollars that you're paying in premium. So if a Plan G Medicare supplement costs on average 22% more than Plan N, and it does, then I give myself a raise if I sell you a Plan G over a Plan N. Now, I'm not saying that one plan is the best plan for absolutely everybody. That's why in my office, we listen to you before we make a recommendation. We listen to how many times you go to the doctor. How sick are you? How long did your parents live? What are you paying right now when you go to the doctor? All those things are important to listen and take into consideration. But for the vast majority of agents that even talk about Medicare supplements as an option, most of them are pushing into Plan G. And here's the difference. They're going to give you a rate increase based on their experience. So look instead at Plan N. Plan N is way different than the experience of Plan G. Now, granted, in 2023, they had bad experience, both of them. They did. But look at the difference. If you're going to take a rate increase, I'd much rather you have a rate increase based on the experience of Plan N, let me show you that again, than Plan G. Big, big difference. And over time, when the traditional losses are consistent, we see that Plan N has consistently lower experiences and claims, and that is passed on to you, the client. So if you want consistent premiums and you want, here's what I tell my agents over and over again. If you want things to be able to be affordable for years to come, if you want to be on original Medicare and all the benefits, and that is you can go to any doctor in the country that accepts Medicare. You can go to any cancer treatment center in America. You can go to the Mayo Clinic. You can go to Johns Hopkins. You can go to all the best treatment centers in the country without even asking if you're in a network or not, because there is no such thing as a network with original Medicare and one of these Medicare supplements. But if you want that, at least get the plan that you know will be the most affordable years and years and years down the road, because sometimes in most states, you can't just arbitrarily change between Plan G and Plan N anytime you want to. You have to go through health questions later on. And to ensure the fact that you can make sure you can afford it, then Plan N is a viable option for a great many people. But again, we have to listen to your particular story. If you want information on how Plan N works and whether or not it's going to be a good fit for you, I highly encourage you to go to my website that compares the two in great detail and shows historical evidence why one might be better than the other. Again, we're paid less for this, but go to my website and see the research at plannmedicare.org. Now, it's not just Medicare supplements that are having rate increases and rate impact. No, it's also Medicare Advantage plans. And the Biden administration passed, and I'm not being political here whatsoever, they passed what they called was the Inflation Reduction Act. And there's a famous quote that I remember as I was a child from my favorite president, which was Ronald Reagan, who said this.
9 most terrifying words in the English language are, I'm from the government and I'm here to help.
Ronald Reagan said those words, And I've said that repeatedly over and over again. Every time the government tries to get in with regulation to say we need some consumer protections, like they've done in the state of New York, for instance, with Medicare supplement plans. And they said that in the state of New York, consumers should be able to change Medicare supplement plans anytime they want and go to any plan anytime they want. And boom, insurance companies, you just have to deal with it. Washington State, California with the birthday rule. What happens in these states? The government mandate and that regulation is good for some people, but it causes the rates to go through the roof because the insurance companies are not nonprofit entities. They pass that on to you. Here's how it's going to affect every single one of you on Medicare with this, the Inflation Reduction Act. Let me share with you a slide from the Kaiser Family Foundation. This is the nonprofit arm, not the Medicare Advantage company, of Kaiser Family Foundation. And they looked at what's going to happen in 2025 and beyond. I'll draw your attention by putting a red box now around the important part. Look at this. In 2025 on drug plan spending. Now, let me just remind you, if you're on a Medicare supplement plan, then you also likely have a standalone Part D drug plan to go along with it. So this impacts you. If you're on a Medicare Advantage plan, what we call in the industry an MAPD, which is Medicare Advantage and Part D, it's what Humana likes to call in their commercials, it's an all-in-one plan. If you're on that plan or the complete plan, which has your drug plan rolled in, this impacts you as well. I'll zero in a little bit further so you can see how it's going to impact you. Up to this point, there's been no max out-of-pocket on drug plan costs. At least the insurance company didn't give a squat about it. But in 2025, watch the next box that highlights right here. The cost, once you've reached $2,000 out-of-pocket spending for drugs, and a lot of people do, millions do, guess who takes that cost on? The insurance company. Now, again, listen carefully. If you're on a Medicare supplement plan and you got a big rate increase for 2024 because all the companies are doing it to make up for the losses from 2023, this thing is going to hit you on your drug plan in 2025. I'm not allowed by law to tell you which companies have already announced to us that they're pulling out of the Part D market next year, but several already have. It is more critical now than ever that when it comes to September and October, when you receive in the mail, or if you erroneously signed up for electronic notification, you'll get it by email, your annual notice of change. That is what's going on with your plan for next year. You'd better pay very close critical attention to what's happening because there is a very good chance that the plan that you're on right now will not be there for next year. Because there's a provision in the law, in the Part D law, that says the insurance companies are only allowed to raise your rate by a set number each year, 6-7% rate increase on your Part D monthly premium. However, if they pull that plan off the market, then they have to, what they do, crosswalk you is what they call it. They'll crosswalk you into another plan that they have. Rumor has it that some plans that have been 50 cents a month will be crosswalked into a plan that's now $90 or $100 per month. And that's only the premium. Other things that they're trying to change for next year are where your drugs fall on their formulary. What might have before been a tier 1 or a tier 2 drug, very cheap, might now be a tier 3 or a tier 4 drug for next year. Why? Because again, they're taking it on the chin, and the insurance company does not just lay back and say, "Oh, that's okay. We'll take that loss." They don't make much money on Part D anyway. Trust me, I can tell you, because they don't pay us agents on Part D. But where I'm really concerned is for those folks who have a Medicare Advantage plan with a drug plan just enrolled with it, just all rolled into one. They have to take from all the other stuff, you see, in order to make up for the losses in the drug plan component. So where you might have had meals delivered after a hospital stay, You might have had a pharmacy card where you can go in there and get Band-Aids and you can get toothpaste and you can get these things. You might have had a free dental plan that usually most of them are junk, but maybe you had a dental plan that was comprehensive in your unique Medicare Advantage plans. And there are a vast variety of plans. Those things are going to drastically change for next year because of this, the Inflation Reduction Act, and how it's going to impact the drug plan component. So all this change means you better be linked up close, arm in arm with your insurance advisor. Hopefully, your agent is not just running ads, making cold calls, knocking on people's doors when they're turning 65, and they forget about you because you've already signed up. In our office, we reach out to everybody when it's their time for a renewal to see if we can help them in any way, shape, or form. But this year, it's going to be a huge burden to stay on top of all this stuff. But we're going to do it for you. I've got a lot more to cover, so don't go anywhere. But if you would, please do me a favor. Subscribe to this channel if you've not yet already, because the critical changes happening in Medicare are important for you or anybody that you know that's on Medicare. Please share this video and share this channel. Again, I've only got 100% track record when I talked about things impacting things on Medicare, like MACRA and the modernization of Medicare plans. All the things that I've predicted have actually happened. But this is right out there in plain sight. Everybody can see what's happening with the Inflation Reduction Act and how it's going to impact your drug plan, where it may or may not be affordable anymore. Here's some change. Now, if you don't believe me, watch this recent news story. They're bad commenters on the news, but this is just one of many stories just starting to come out about what's happening next year.
Advantage customers may see a major cut in their health care benefits next year.
It's a move that could affect how people in rural areas get medical treatment. 7 News' Anthony Nguyen explains.
It's a chess move being made by some big players in the healthcare industry. Insurers like Humana, Aetna, and United Healthcare, who are all over the Medicare Advantage plan, say they might have to stop providing services to consumers in counties where the dollars don't make sense. This is the insurer's response to health benefits in from the Medicare Advantage plan in 2025. Insurers are blaming rising health care costs for the cuts, but believe they will see a huge increase in their financial performance with next year's cuts. An announcement from Aetna has set an exodus plan in motion for many major insurers, who now say they will pull out of counties where they are not seeing a profit. Here's a look at some of the benefits that you could lose, include prescription drug coverage, dental, vision, hearing, and even meal delivery after a hospital stay. A Wall Street Journal article says Aetna plans offer fitness reimbursements, pickleball paddles, golf clubs, purchased with some of their benefit plans. And yes, all those nice perks would go away. Now, if you have a Medicare Advantage plan, you don't have to do anything just yet. In the meantime, mark your calendar to check the Medicare Plan Finder in early November for the updates on the 2025 plan changes.
Yeah, you better watch your annual notice of change coming up in September and October, because they're going to be drastic changes ahead. I'll share with you another news story that goes a little bit longer from Yahoo Finance, talking about this in greater detail, but it's going to impact, again, every Medicare Advantage plan and every senior who has a Part D drug plan. They're going to be affected big time. Now, I shared with you earlier a little clip from Senator Whitehouse talking about prior authorization, how they're trying to get that fixed, how they're trying to get it changed, and some things are happening with that. But first, let me go into the differences on Medicare, because so many agents just don't share this with you. When you go into Medicare, you have two choices. You can go the wide road, or you can go the road less traveled. We predominantly help people with the road less traveled. That is original Medicare, staying on the plan that you've contributed to your entire life. You've already paid in for it. That's your benefit that you deserve. That's here in the green. And that's where you can stay on original Medicare, start Part B. Part A should be no cost for you. We can help you do that at howtostartmedicare.com. Again, howtostartmedicare.com. I'll put that on the screen in a minute. But on original Medicare, it's fantastic insurance. You can go to any doctor and any hospital that accepts Medicare, which is the vast majority of any provider in the United States. And with a supplement, it covers the holes. That's why they call it a Medigap plan. It covers the holes of original Medicare, leaving you with freedom and flexibility without the worry of mass out-of-pocket costs. The supplement plan pays for that for you. Or you could go on the plan that pays us as agents $600 or $700 to sign you up for that plan. That's a Medicare Advantage plan that comes with massive restrictions. It comes with a prior authorization that the senators were talking about before. Again, that's exclusive to the Medicare Advantage world. And why would people sign up for that? Why would people sign up for a plan that can deny you care and routinely push off prior authorization? That even has prior authorization. Your doctor already said you needed something. They sign up for those plans because they're cheap. They're actually, in many cases, no charge at all. They call it free. Well, fantastic. If it's free, what do I get for that? Well, you get a whole bunch of promises and a whole bunch of lack in there. Look at the study that's in the description of the video. I won't go into it in detail. From, again, the Health and Human Services, they talk about that. With original Medicare, you can add a Medicare supplement policy, otherwise known as Medigap. With Medicare Advantage, you better add a cancer plan. Now, in New York and California, you can't do that after the age of 65. But again, when the government comes involved,
9 most terrifying words in the English language are, I'm from the government and I'm here to help.
Again, so in New York and California, when you're 65, you can no longer purchase a cancer plan that is a cash infusion to you upon immediate diagnosis of cancer. See, the big problem with Medicare Advantage is there are these massive, massive gaps, and people are not learning about this from their agent that signs them up for it. They're saying, oh, if you go in the hospital, it's only $300, $500 a day, but don't worry about it. You've got this catastrophic max out-of-pocket thing that's going to protect you. What they don't tell you is if this happens to you in October, November, that happened to my grandmother, and you have to go back in the hospital in January, guess what? Your max out-of-pocket is suddenly not there. It reset January 1st. So you got to hit that all over again. And they're severely lacking on cancer treatment coverage, meaning they don't have Cancer Treatment Centers of America. They don't have the Mayo Clinic. They don't have these cancer treatment centers that are the best of the best of the best. No, they have the lowest bidder. They have the folks that trained in other countries predominantly in the cheapest possible coverage you can get. And if it's approved, first you have to go through prior authorization and then you get routine denials. But if it's approved, you can only go for the services that their cheapest doctors said you can go for. And you get the benefit of paying 20% out of your pocket for all those services. 20%. Your cancer coverage is extremely limited on Medicare Advantage. So we advise all of our people that go on Medicare Advantage. And yes, we help people with Medicare Advantage. If that's the best plan for you, we'll help you with it, but we'll give you honest guidance and tell you where the pitfalls are. And one of them I can tell you right off the bat is going to be cancer coverage. We can help you with that. If you already have a Medicare Advantage plan and you got it from somebody online, you got it from Joe Namath or Bill Shatner, somebody on the TV, and you did not plug these holes of hospital indemnity insurance to cover that big cost or cancer coverage specifically for cancer, please call us in our office so we can help you. Go to our website and click on the help button. I'll show you what that looks like. We can help you. Here are some websites that may help you. Cancer, you can go to cancerplan.us and find out what's involved in those plans. You can fill out a simple, secure form and we can contact you to help you. If you're on Medicare due to disability, there's special rules on that. If you're on Medicare under the age of 65, go to that website and we can help you. You can pause the video or come back and we'll show you these links again right there. But if you come to our website, this is the easiest way to get free help. Click on the green button and go to where it says Medicare Help. Our service is free, doesn't cost you a dime. So I highly encourage you to go there. I'm going to show you in its entirety now the video from the U.S. Senate where they talked exclusively about Medicare Advantage and what it's doing to people. You better pay attention if you're considering Medicare Advantage. And again, we help people with Medicare Advantage, but we want you to go into it eyes wide open so you know what you're getting involved with. Can you, you're asking, go from Medicare Advantage to Medicare Supplement when I get sick? In most states, no. You've got a 1-year window that you can utilize what they call trial right. That is, you can try Medicare Advantage for a year. After that year, in most all states, you then have to go through medical underwriting to go into a Medicare supplement, which is considered higher coverage. So if you start off with Medicare on a supplement, that's fine. It's open enrollment. All bets are off. No health questions whatsoever. You got that 6-month window to get on a Medicare supplement when you're brand new to Medicare. Beyond that, you have to go through health questions. So if you start on a free Medicare Advantage plan, you have a year to consider going to a different plan. We have a lot of people that call us and say, this is for the birds, get me off this plan. And we just hope, we really hope it's within their first year. Otherwise, we can help with the underwriting, but it's a lot easier if you do it when you're new to Medicare. Experience matters. Again, 27 years of industry experience. We have a staff in here that we train constantly, and we're always watching the trends and what's happening with the Medicare arena from coast to coast and in your state where you live, so we can tell you what the best alternatives are. Again, our service doesn't cost anything. Please make a note of the phone number. Again, you can pause this video, you can come back to it, and it's in the description below, or you could Google search Senior Savings Network and click on Medicare Help where we can help you. My name's Chris Westfall. I'm going to show you the Senate hearings here, so don't go anywhere. Or you can even scan this on your phone, on your smartphone there. I used to be in law enforcement helping people to prevent them being screwed over by criminals and nefarious people out to hurt them. And now I do the same thing in the insurance world. I'm just here to help you. Got an amazing staff that would love to help you. So please watch what's going on with Medicare Advantage. And these are the recent Senate hearings. I've got just the best clips here for you. But if you need us, reach out. Thanks for watching.
Actual lives are at stake. One of my constituents, Deb from Cumberland, faced cruel insurance hurdles in the wake of a brain tumor diagnosis. She said, "If fighting this disease wasn't enough to deal with, I and others are constantly fighting with insurance companies who are trying to deny every treatment path. For some reason, they feel that they know what's better for us than the medical community." One particular scourge for patients is prior authorization. Confusing, cumbersome, and inconsistent insurance rules that stop care, while providers have to spend valuable time documenting and justifying the clinical need for a medicine or a service. In a value-based system, where doctors make their money by reducing costs and keeping patients healthier, there is no logic to prior authorization. So I propose that companies in Medicare get prior authorization from CMS before they're allowed to impose prior authorization on doctors practicing in successful accountable care organizations. A 2022 Surgeon General Advisory Report links administrative burdens with healthcare burnout, with less clinician time with patients, and even with harm to patients. The Surgeon General specifically called on insurers to, and I'm quoting him here, reduce requirements for prior authorizations, streamline paperwork requirements, and develop simplified common billing forms. When the Surgeon General is focusing on administration, you know it's long past time. My reform legislation will require the Centers for Medicare and Medicaid Services first to identify the worst prior authorization practices in Medicare Advantage. Second, it requires CMS to set common standards for common prior authorization requirements across insurance plans. Third, it will lift the prior authorization burden completely off providers and accountable care organizations with a proven track record of efficient patient care. No prior authorizations without prior authorization. I doubt insurers will be able to justify prior authorization for value-based providers whose incentives align with theirs.
CMS should be aggressively auditing Medicare Advantage prior authorization activities so that we have a clearer understanding how the patient, providers, and taxpayers are impacted.
73% of providers reported an average wait time for a prior authorization to be at least 2 days. Of the 73%, 38% of providers reported an average wait time for a prior authorization to be at least 3 to 5 days. 31% of providers report that for patients whose treatment requires prior authorization, the process often leads to patients abandoning their recommended course of treatment.
What you did is basically unravel the insurance company argument for prior authorization. What the insurance companies so often say to all of us is that authorizations are supposed to help patients get better care. And what you said is based on your analysis and your work as it relates to the asthma medicines, the inhalers, people get worse care.
I think the reporting on the extent to which insurance companies are using prior authorization to delay payment for cash flow purposes, and unfortunately, the delay treatment in the process of delaying payment. So reporting on the timeliness of prior authorization clearances, I think, is a terrific idea.
And Mr. Chairman, you understated the problem. It's hard to imagine that as senators, but we've understated the particular problem. Let me just tell a quick story. Running our hospital, had a horrible ice storm on a Wednesday night. Thursday morning, the hospital is booked for surgeries. Orthopedic surgery already starting at 7:30, and they're going to go till 10 o'clock at night. The other ORs are full. We have a finite number of surgeons, anesthesia, and nursing staff. We had 7 or 8 admissions overnight, people falling, breaking their wrist, breaking their hip. So I give authority to, we're going to bring everybody in at 5:30 in the morning, start the cases at 5:30. 90-year-old lady fell and broke her hip, which is a critical, life-threatening thing to a 90-year-old lady. And you get everybody there, and then the administrator comes and says, oh, we can't do this case. How come? Well, we don't have prior authorization yet. You know, that story is told over and over that insurance companies are now using this to ration care. It's delaying care and purposefully delaying care, hoping, I guess, that they die before they do the surgery. But there's good news. We're going to reintroduce our prior authorization bill, Seniors Timely Access to Care Act, this June. And this is the solution. So we know the solution. Now we need Congress to move forward. What this bill does, among other things, is set guardrails, streamlines, and standardizes the process for prior authorization. It is this prior authorization reporting requirement in our bill is the RX to cut down waste, fraud, and abuse. We've got the solution. 53 Senate co-sponsors, 10 senators on this committee, including the chairman, are co-sponsors of this legislation that we're reintroducing in June, if I didn't get that message right. We have 326 House members. We have 550 outside organizations. We've now got a 0 CBO score. So I speak to the minority and the majority staff that we now have a 0 CBO score on it. And there shouldn't be any reason that everybody on budget, on health, and finance committee shouldn't co-sponsor this bill and be passed with unanimous consent. I appreciate the chairman continuing to highlight the situation. Now, here's the bad news, is our bill only addresses Medicare. We need to go into the private practice as well. Certainly what we're seeing back home is Medicare Advantage started off as a great thing, kind of a value-based theme, but now it's being abused. Imagine that, that we're having horrible products sold out there, and for a giveaway for a toaster, you too can have a cheap Medicare Advantage solution as well.
And it's even difficult for us who know what I consider to be the game around not getting timely responses back and holding back really what's important care that's necessary to the patient at a time in which it's most important.
Yeah, Dr. Cutler, are you seeing, this Medicare is a problem, Medicare Advantage, but it's also in the private sector, obviously.
Private sector, it's Medicare Advantage, commercial insurance, and Medicaid are the biggest ones where you see it.
Yeah. Yeah. Dr. DeGiorgio, anything to add? I mean, I think we beat the horse pretty good here, but.
Yeah, I totally agree. My wife's also an OBGYN, so I think she feels the pressure as well as me. I think to the administrative burden side, when my 4-year-old daughter says she's playing doctor, and that means she takes out her toy laptop and starts typing on it.
Oh my gosh.
She sees my wife and I come home and just spend, our waking
I'm so
hours
sad
at
to
home.
Yeah, on
our
But
this
is why none of my kids went into medicine. My wife a nurse, I'm a doctor, 4 kids, 0 go into healthcare. It's because we were so, the administrative burden is the start of the tip of the iceberg, let alone a nurse who hasn't seen a patient for 10 years telling me I shouldn't do a hysterectomy. It's very frustrating. Thank you, Mr. Chairman.